Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Implant Center.
And I'm Kaylin. I'm one of Dr. Choi's surgical assistants.
All right, so the reason I have Kaylin here is because we do thousands of dental implants. We do tons of these implant supported solutions. We do extractions. We do regular dentures. And so we have a lot of confusion amongst our patients about, hey, what solution is best for me? Do I want to get a regular denture? Do I want to get a snap-in denture? Do I want to get an all-on-4 or like this teeth in a day solution where it's fixed? So we created multiple videos. So we also have videos talking about the pros and cons of regular dentures. So I highly recommend you watch that video. We also have a video where we talk about the pros and cons of the all-on-4, the fixed solution, right? So I recommend you watch that video also. On this video, I'm going to focus in on what we call the snap-in denture, the snap-on denture. A lot of people call it different things. In the industry, we call it an implant-supported overdenture. That's its technical name. So basically, what an implant-supported overdenture is that it is a denture that you see here. It looks very similar. It's just basically a regular denture, and it stays in place inside your mouth because we have these implants that we place in your jaw. And through the gums protrude these little attachments, which I like to call like the male attachments. And then also we have the female attachments in the denture, which allow the denture to snap in place, as you heard that little clicking. So because of that, this denture is not flopping all over the place if it didn't have dental implants. Okay, so I'm going to show you some close-ups. So this is the bottom of the denture here with the female parts. This is what it looks like the imitation of your jaw with the little attachments coming through your gums. Those are the male parts, I like to say. Here's a view from the top, and also this is what the denture looks like snapped in place. All right, so let's talk about pros and cons of this. So what are some of the pros and cons that patients tell you?
Yeah, so cons-wise, if you're going from a traditional denture or you have a mouth just that is deteriorating and that just isn't functional anymore, switching to a snap-on, patients find it a major improvement. The functionality, the durability, you don't have to worry about denture paste, you don't have to worry about the movement, which causes ulcers. You can eat better, you can talk better, there's less plastic in their mouth so they can taste more, which is great for most patients.
Right. So what I wanted to focus on, a few things you said, sores even, right?
Yeah.
So like, I mean, your movement of your denture, your regular denture, if it's moving around too much with your mouth, it's banging around when you're eating, and it can keep on rubbing up against an area and can cause sores, and patients get really frustrated with some of that. Even bigger than that, what we were talking about, you know, a regular denture is just moving around too much because it lacks retention and stability. Retention meaning how well is it retained within your mouth, right? So is it like falling out when I'm talking? You know, we saw that movie Mrs. Doubtfire back in the day, like he's drinking water, his denture falls in the water. That would be highly embarrassing. I've heard stories of like that. This is not just something you see in the movies. Do we hear stories where denture falls out at inopportune moments? So we want good retention. The other thing is stability. These dental implants allow us to have stability. So I can push on one side and my denture's not flopping over. Same thing with this. My denture's not flopping over this side. So we have stability of our denture due to the dental implants. So, you know, the snap-on, snap-in denture is a great solution. Pretty much like I said, it's actually the middle tier solution because this is going to be your lowest tier solution with a regular denture. The snap-in denture is going to be your middle tier solution. And then the all-on-4 is going to be your highest end solution. So again, I recommend you watch those other videos to really get a sense of which solution is best for you. Anything else you want to add, Kayla?
Yeah, so just again, the all-on-4 versus the snap-on, or if you're going from having teeth to it, it's not going to be specifically, you're not going to feel like you would with your natural teeth. All-on-4 comes the closest that science will let us at this point in time, but the snap-on is something that is going to be better than if you have a traditional denture or if you have a deteriorating mouth. But it still lets you keep that bone, still lets your bone not deteriorate as well.
Right. Life is about expectations, guys, right? So what we like to tell patients is, if you had really bad teeth and you're going and you want a better, like you want teeth that look good and you can function and chew again, then like a snap-in denture can be really great for you. Also, if you had a regular denture that was like flopping around all the time, like a snap-in denture can be very much improved for you. However, an all-on-4 or some sort of fixed solution is going to be the best option. So this is like, a lot of times they say in life you get what you pay for. This is one aspect of dentistry. Truly, you get what you pay for. So your overall satisfaction, stuff like that.
And we have great videos. I know you're hearing it from us. We work in the business, but we have great videos of patients themselves from their perspective on how they feel about the difference between traditional to snap-on and snap-on to all-in-4 as well.
Right. So they give us their own personal experiences because they made the transition from those, and so we can only tell you what they say. So. All right, hopefully you guys found this information to be very useful. If you guys have any questions, please feel free to come on in. We can do a scan on you, a complimentary consultation, and we can go over your personalized needs and basically answer any other questions. Hopefully you guys found this information helpful. Thanks.